largely we're talking about criminal penalties, and this exists really across the United States and global in the global context as well. So a lot of the things that we're talking about are why criminalization is a barrier, why folks who, from sex workers to people living with HIV to drug users, to folks who seek abortions, why because of criminal penalties, many of folks are marginalized. So are poor, are black and brown, live in the global south. So we're really talking about the barriers that exist that make them more likely to be criminalized and punished by many state statutes and federal laws.
When we talk about criminalization, we're often talking about direct criminalization with a statute that might name the exact sort of violation and penalty, or we may be talking about a set of morality codes or sort of less explicit codes that are used disproportionately or entirely to police only certain sets of behaviors from certain sets of people. And when we're talking about criminalization in this context, we're especially talking about it around sexual and reproductive health and rights, and how criminal codes are used to police consensual sexual behavior between adults. And that's a really important distinction because the whataboutism comes in heavily when you're talking about criminalization, and people start talking about trafficking, coercion, violence, force. All of those things are, even as we sort of think about how we unpack the relationship between public health and criminalization, all of those things are things that we all want eradicated, and we don't want fraud, coercion, force to be part of our own sexual expression or that of others. But what we're really talking about here is the kind of criminal penalties and morality codes that play out for consensual sexual behavior or identity and expression amongst adults.